Amanfo yareboni bebre omudin de but obohu a obema ho akire papa. Why so oba boni a ne ho fefefe ni din de but ogro no ho na oso mu so otetewa ubenu hu so ba asase so. Sa yare no baako edin de dengue fever. Ene ye ka ho asem. Dengue fever is a mosquito-borne illness and it's very common in the tropical areas. Not just Africa, yemfa ye hu ni when it comes to dengue fever. Usually it's a dengue a mild that causes high fever symptoms. And then it also has flu-like symptoms. And if you're not careful, you may write it off. Sometimes it mimics the signs and symptoms of malaria, and until you may overlook it. But it is one illness which is causing a lot of fatalities, and we need to pay close attention to it. The severe form of dengue fever now is called dengue hemorrhagic fever. That one can cause serious bleeding, a sudden drop in blood pressure. Not just say it is going to lead to shock and then ultimately death. Millions of cases of dengue infection occurs worldwide each year. According to WHO statistics, 4 billion people are at risk of contracting dengue infection around the world. The money who said currently there is no treatment, so our best bet is prevention of the infection. Currently, researchers are working on getting a vaccine for dengue infection, but because it is a mosquito-borne illness, our best bet is to prevent mosquito bites, because once you are bitten by an infected mosquito, you will definitely contract the infection. The when you dengue infection, for most people at the initial stages, there are no signs and symptoms. But when you do contract the symptoms, it is very likely you mistaking it for other illnesses, because usually it may make other flu-like symptoms. And such flu-like symptoms will usually begin 4 to 10 days after you are bitten by an infected mosquito. For the most part, dengue usually causes high fever. That is about 104 Fahrenheit or 40 degrees Celsius. And then any of the following signs and symptoms. Of course, there is headache, there is muscle, bone, and then joint pains. You could experience nausea and vomiting. One unique thing about it is that you can experience pain behind the eye. There is swollen glands, and then there can be rashes. So other signs and symptoms here so usually it's other disease conditions. And if you want here, you are likely to mistaking it for other conditions. Not dengue, no din some money. For most people who have stronger immunity, they may recover within a week. But in some rare cases, the symptoms may worsen and then it becomes life-threatening. That is where we have the dengue hemorrhagic fever. In the extreme cases, we are looking at signs like severe stomach pain, persistent vomiting, which means a fear no, bleeding from your gums and nose. Then you begin to see blood in your urine, in your stools, or in your vomit. You'd also begin to see bleeding under your skin. Initially, it will look like some bruises. There can also be difficulty or rapid breathing, and then ultimately fatigue and restlessness. When signs and symptoms then you are looking at the extreme form of dengue infection. When you see these things, there is no point staying at home and thinking, say, malaria, drugstore be, no. Once you see these things, it is time to see your doctor so that further tests can be conducted and then therapy can be initiated. Like we are saying, the condition is a mosquito-borne illness, and so you only contract it when you are bitten by an infected mosquito. That means even if an individual is infected with dengue and you are around that person, you cannot contract the disease. The only way you contract it is when a mosquito bites an infected person and then ends up biting you. The main risk factors are living in the tropical areas, and it's by the mere fact that some of us are in the tropical areas, we are at risk of the condition. Again, if you are someone who have had dengue infection in the past, you stand the higher risk of contracting the condition once again. In the area of prevention, researchers are up in arms. They are looking to come up with a vaccine that can control the condition. However, our best bet is prevention. As much as possible, we need to reduce the population of mosquitoes around us. As much as possible, stay in a well-ventilated but well-screened housing. The mosquitoes that causes dengue infection are usually active from dawn to dusk. They are not very active in the night, but they can still bite. So as much as possible, let your place be well-ventilated but very well-screened. That will mean that if you are someone who is comfortable sleeping in a mosquito net, please do. Yemu bi wo ha ye da mosquito net mu anase mununkum ya che ya na dwono eni nti ye be press a yentimi na yie. But if you are someone who is very comfortable sleeping in a mosquito net, please do. If you are the kind who is not very comfortable sleeping in a mosquito net, then make sure before you go to bed you are applying some form of mosquito repellent to your skin in order to repel mosquitoes. As much as possible, wear protective clothing. But enemrem pa climate change nti woda numa ye hyehyehye na dum so bi nso te wan kona. Wotimi da wo be sore na ohun fifiri. A chance wo kotop mu anadwo no. In such an instance, a bed they pass over to measure protective clothing all day that. Because one chef a crown over double sorry no who you know. But as much as possible, we need protective clothing, especially if you are living in a house with children. Then you need to make sure that they go to bed wearing protective clothing. And then finally, we need to do our best to reduce mosquito habitat. And it is a baby out in so tata baby, you seriously need to treat it and then break the chain of habitation for mosquitoes. Other than that, you stand a higher risk of contracting the condition. Among for any day kakra the buy no one subscribe to the channel now. Please do. Say the bear the topic for Frubia buy. Now once waiting to join in. Tell somebody about this channel and watch other videos here as well. Thanks so much once again for watching. It's a wrap.